oculoplasty in Indian scenario is yet to gain adequate importance, but the mere fact that we have been included in this session is promising and motivating us oculoplastic surgeons to march towards a brighter future. Oculoplastic surgery concerns the correction and restoration of form and function. Oculoplastic surgery is not yet completely cosmetic or aesthetic. There is a diverse presentation as far as oculoplastic conditions are concerned. It ranges from lacrimal disorders, lid and adnexal pathology, tumors in the orbit, and socket pathology. There's been emphasis more on pathology and less importance is being given to cosmesis. Today, happy surgery is truly altering the mindsets of the patients. Patients seek out because it doesn't merely change their looks, it changes their lives. Economic consideration probably spearheads this kind of a behavior. Oculoplasty has gained interest and acceptance merely because of the medical and technological advances, the anti-aging mentality among the population, the patient's sophistication and longevity. There's been a plethora of advances in the form of lasers, endoscope, dermatopharmacological agents. The conventional orbitotomy techniques through cranial approaches and large incisions have been replaced by some form of micro-invasive techniques like the transconjunctival approaches and endoscopic approaches. What was once a dacriocystectomy has evolved to become a dacriocystorhinostomy, which now has been approached through the nose with the help of endoscopes. There have been materials like MedPo which have revolutionized the oculoplastic surgery too. But the unique challenges that we face are the image consciousness of all ages and genders, the quest for perfection, and the maintain or rejuvenate attitude. The world and everything in it is as beautiful as you perceive it to be. Physical appearance does influence how individuals are perceived by others. Better appearance and attractiveness, any intelligent person would aspire for it, not for pleasing others, but for the love of beauty itself. So the goal of aesthetic surgery in oculoplasty has been to restore the lost facial volume, enhance the normal facial features, and correct the facial asymmetry, which can be achieved by surgical procedures like blepharoplasty, fillers and injectables, laser resurfacing techniques, and it has been customized for every individual. Oculoplastic surgery is a marriage of beauty and science. In this particular patient, he's been suffering from blepharospasm, which requires a functional treatment. It is inclusive of vein treatment, skin rejuvenation, cosmetic fillers, microderm abrasion, chemical peels. Botox definitely has revolutionized. The use of CO2 laser for functional blepharoplasty has played a very important role in decreasing the postoperative edema for patients, and better results have been achieved with laser blepharoplasty and resurfacing in conjunction with Botox. The Newsweek issue included a breakout of the most common procedures for men and women by age group. Adults 35 to 50 years of age represented the largest market, and eyelid procedures, especially blepharoplasty, were most common for adults 51 plus. Oculoplastic surgeons are expanding their cosmetic skills by working in the periorbital area. Some are going beyond into the greater cosmetic domain, but it's definitely possible only in large setups. But the key is to keep the eye with the eye plastic surgeons. Many surgical specialties perform cosmetic surgery of the face. Oculoplastic surgeons are the most knowledgeable of the anatomical and functional characteristics of the eyes. Many oculoplastic fellows have been trained over the years. Several of them have implemented training programs where they train fellows. General ophthalmologists and more specialized oculoplastic subspecialists are at a unique crossroad. They hold the expertise in the eye-related surgery, which clearly sets them apart from non-ophthalmic physicians and surgeons. The public truly is not aware of the unique skills we offer. A less qualified physician may just snip off loose skin from patients' eyelids, not knowing that this may trigger extremely troublesome symptoms of dry eyes, or patients may not be able to close their eyes at night as a result of a blepharoplastic surgery. Most oculoplastic surgeons are reluctant to move into the commercial aspects of the cosmetic surgery, quite understandably, because it's definitely a price thing and the basic practice principle. Patients don't understand the unique skills, knowledge, and expertise that an oculoplastic surgeon has in providing treatment and care. So there's no one in a better position to handle the eyes, the eyelids, and the tissue around the eyelids than an ophthalmologist who has intensive training in ophthalmology and additional training in eye plastic and reconstructive surgery. Yet, ophthalmologists aren't better known for their skills. Ophthalmologists are striving to educate physicians and the public on the skills and merits of oculoplastic surgery. Value-based marketing is the key to success for every practice in positioning it properly in the community. Definite need to develop and use internal and external marketing to reach out to set its own mark. The future of the subspecialty depends on what ophthalmologists like doing, where their market needs are, and what opportunities they can seize. Ophthalmologists should be able to maintain a more balanced traditional medical and surgical practice. If oculoplastic surgeons want to succeed, they may have to do many different procedures and do them well. It has been an era of technology with rapid permeation into our lives. In case of a conflict of interest, logic should definitely supersede technology without a doubt. For example, in cases of DCR, I would definitely opt for an external DCR when it comes to a case where there has been multiple surgeries rather than going for a laser DCR, which is technically very simple and easy. There is adequate scope for research in the form of developing consumables at affordable prices, stem cell research in surface disorders, genetic analysis and gene therapy, tumor markers and specific diagnostic indicators. After all, these are the only specialists among the ophthalmologists who not only try to salvage the globe, the vision, as well as the lives of the patients. As the most venerable Dalai Lama opines, we are living in interesting times. Times of fast foods but slow digestion, an era of more information and less wisdom, an era of more entertainment and less content. And finally, oculoplasty and aesthetic surgery has to be bought by the patient and not to be sold by the ophthalmologist. Thank you very much.